Hi there, welcome to this video which is intended to be a guide which covers all of the different assessments you may do as a paediatrics trainee. So there are two main categories of assessment. The first are supervised learning events and the second are assessments of performance. So SLEs are assessments that you complete within the clinical setting and you have input from a senior clinician to evidence your learning and any areas of development. Whereas assessments of performance are where an assessor is directly looking at your practice in a summative sense. So this may be your clinical procedures or giving you advice and feedback through multi-source feedback. There are generally nine different types of assessments, and depending on the focus of the event, you use these different ones. This seems like loads, but don't panic. So the first thing to know how to do is how to complete assessments using the Kaizen ePortfolio system. So once you've logged in to Kaizen, you will be on your dashboard, and if you click on the timeline section and click on whole timeline, you will see all of the assessments you've done so far. To start a new assessment, click on Create New. The assessments will then be in this assessment subsection, and you can see the names of the different assessments here. So then just click on the appropriate one, and it will then open up and you can click when the assessment was completed. You can add a description, and depending on what type of assessment, there will be boxes to fill with information. And once you've filled in the information, you should then reflect upon what has happened. And this may be positive points, it may be things you think you can work on further, or just general reflections where you might bring in any relevant evidence or other sources of information. The last thing you need to do is tag curriculum domains to this assessment. Generally, the Royal College expects you to tag a maximum of 2 different domains, and unless this is an exceptional case where perhaps there is a lot of complexity or it's very clear that you can link these other domains into your assessment, you shouldn't do more than 2 domains. When you see the 11 different domains here, you can click on them and it will show you level 1, level 2 and level 3 learning outcomes. You can then click on the appropriate level, and you should really be tagging the levels of the training you're in. So if you're a level 1 trainee, so an ST1 to an ST3 trainee, you want to make sure that over the course of those 3 years of level 1 training, you meet all of the level 1 learning outcomes. So I've clicked in domain 1, I've clicked in the level 1 section there, and then there you can see the key capabilities for a level 1 trainee in domain 1. So if I think that the case I have done meets these capabilities, I can tick them. For more advice on how to meet different domains, you can check out our Domain of the Month posts on the KSS website, or there may be relevant e-learning which can help you learn more about different domains, which you can then tag into your learning. Once you've done that, you can then type in the name of someone to fill in the next section. So this would be someone who is more senior than you. So if you're a level 1 trainee, it's entirely appropriate to get a registrar or a consultant to fill it in. This might mean that as you progress through your training, it can become more difficult sometimes to get assessments filled in because there are less people for you to choose from. But as long as you discuss that you're going to do an assessment with someone in advance, then the two of you can either arrange to do it together, or you can fill out your section and then send it off to them. So you would start typing in a name, and then you can pick the appropriate person to then send your assessment to. If the two of you are filling out the assessment together, you can choose to fill it in on the same device, and that person can then fill it in at that time. It will still be sent to them when you finish it for them to sign off the assessment on their own Kaizen account. When you're finished on this page, make sure that you click submit, or rather send to assessor, which will be in the top right hand corner. So going back to these assessments, the Royal College have a table on their website, which is shown here, which generally sums up the number of supervised learning events and assessment of performance assessments that you're expected to do. There's no minimum number that you have to do in total. In general, the Royal College expects you to do 1 to 2 assessments per month, but in some categories there is an expectation that you'll have done a certain amount within a certain period. So, for example, as a level 1 trainee, between ST1 and ST3, they expect you to have done at least one handover assessment tool. Similarly, with safeguarding case-based discussions, they expect you to do one of these each year. And there really is an emphasis on trying to do good quality assessments, so looking in depth into the cases that you're learning from, rather than just doing a bigger quantity of them. So moving on to the first of these assessments, a CBD, a case-based discussion. This can be performed on any case where you, an assessor, discuss things such as record keeping, clinical assessments, investigations, referrals, management of challenging and complex situations, or treatment of a patient. And generally, the RCPCH recommend that the focus of discussion should be around an actual entry made into the notes, and you then explore that clinical reasoning and the decision making. Try and proactively identify interesting cases so that you can ask your seniors if you can arrange a time to discuss the cases. As an ST1 doctor or an earlier level 1 trainee, these cases don't have to be overly complex, but they should demonstrate that you've gained an understanding of the situation, and as a level 1 trainee, you might expect to be gaining experience with the bread and butter, the routine cases of paediatrics, so things like bronchiolitis or viral wheeze or gastroenteritis, and from there, as you progress in your training, you can discuss more complex cases. Moving on to the Mini-CEX, the Mini Clinical Evaluation Exercise. This is a formative assessment, and the assessor has to have observed part of your encounter. So they have to have seen your clinical practice, or at least part of the encounter, and then you can talk about it and discuss the strengths and weaknesses. So this can cover things such as history taking, communication, the physical examination of a patient, clinical judgment, management, professionalism, and organisation. There's no minimum number of Mini-CEX assessments required, and like I've said before, you should aim to do quality assessments rather than meeting a given number. Each Mini-CEX should look at different clinical problems. So you may do these based upon your professional development plan that you've set, and you get to choose when you do them. So simply approach an assessor, or if an assessor has said this would be a good case for us to do a Mini-CEX on, then you can complete that and put it in your portfolio. The next assessment is discussion of correspondence. So this is a learning event which looks at your correspondence, your written communication. So that may be clinic letters, it may be clinical notes. Now, from the start of ST4, so the start of level 2 training, you will need to have 5 letters or pieces of communication that are reviewed per training level. As a level 1 trainee, These assessments are optional, so you do not have to do them. The HAT Handover Assessment Tool. This one is a supervised learning event which looks at your ability to hand over patients. So the assessment should look at your capability in some or all of these areas, looking at the structure of your handover. For example, if you use the S-bar format, a safety briefing, so if you make it clear if there are high-risk patients or if there are safeguarding issues, the ward management, so if you're aware of bed issues or staffing issues, workload, so identifying patients that can be discharged or expected patients that are coming in, and also non-technical skills, so your time management. A good chance to do this might be your morning or evening handovers, especially as that's when a consultant is likely to be present and they can then do the assessment based off of that. Trainees should aim to complete a minimum of 1 HAT in level 1 and 2 HATs in level 2. They are optional in level 3, and at least one of these should be completed by a consultant. Next is the ACAT Acute Care Assessment Tool. So this is an assessment which will be a more global assessment, generally over part of a shift where someone is watching you. For example, the post-take ward round or the acute take in an emergency setting, and the assessor does not have to observe the whole of the shift, but they have to be able to comment in several of the areas shown on the right of my screen. So things like your clinical assessment, medical record keeping, investigations, prescribing, time management. It is similar to a Mini-CEX in the sense that it is looking at your clinical practice, but it takes a more global view on not looking at just one case, but your practice over a period of time. The leader assessment, as it suggests, will focus on leadership and team working capabilities. Your assessor is likely to focus in on 1 or 2 of the following domains. So it may be your leadership in a team, providing effective service, acting within a team, direction setting, enabling improvement, reflection, and it's really important to note that a leader can be based either on clinical or non-clinical settings. So it does not have to be your leadership within a resuscitation call. It could be your management of a service, or if you have developed something within a group, as long as you have shown those leadership skills. From ST4, so from the start of level 2 training, 1 leader assessment should be completed per year, but in level 1, a leader is optional. Now we have safeguarding case-based discussions. So these are very similar to typical case-based discussions. You use them as a case-based discussion, but there is simply a focus on managing safeguarding. These cases do not have to have a full safeguarding case, so it doesn't have to be a patient who has been admitted solely for safeguarding purposes, but you could look at elements within perhaps a more general case that can be applicable to safeguarding. Now moving on to the 2 assessments which are counted as assessment of performance. The first of these is the DOPS, Directly Observed Procedural Skills. This is where an element of a clinical procedure is observed and you are judged as to whether or not you are competent to perform that procedure, and you may need to repeat this DOPS until you achieve competence. There are a few DOPS which are mandatory, and you are expected to be competent to perform these unsupervised by the end of level 1 training. So, as mentioned, if you have not achieved the standard on your first attempt, you can redo this until you are competent to do it unsupervised. These DOPS can be used either as a formative tool, so simply to document that you have done a procedure, or as a summative tool where it's intended to show that you are competent to perform it unsupervised. Both can be signed off by consultants, more senior trainees, nurse practitioners, or anyone who themselves is able to supervise you and judge whether or not you have completed the procedure appropriately. So those compulsory DOPs are bag and mask ventilation, and this can be evidenced by making sure you're up to date on life support skill courses, peripheral venous cannulation, lumbar puncture, tracheal intubation of newborn infants, and umbilical venous cannulation. There are also a whole host of optional DOPs, as you can see on the screen here, and you do not have to complete these, but it is useful to evidence your learning if you have done these procedures to show that you are able to do them. Finally, the last of our assessments is the multi-source feedback. The MSF gathers a range of views on your work around your clinical care. The last of our assessments and the second of the assessment of performance is the multi-source feedback, MSF. The MSF gathers a range of views on your work around clinical care, and it applies the good medical practice guidance from the GMC, looking at your assessing and teaching, your working with colleagues, and your relationship with patients. You need to complete one of these each year. You need to receive at least 7 responses, and you can receive up to 20 responses in total. And 1/3 of the responses you get should be from consultants. Now, in this body of consultant responses, you should include your educational supervisor. 1/3 of your responses can come from other medical staff, so other doctors, and the final third of your responses can come from nursing staff or other allied healthcare professionals. You are in charge of approaching people to ask if they are willing to complete an MSF form for you. Try and do this in the middle of your placement so that staff know you and they're able to assess your performance, but also so that you have enough time to chase people up and ask them if they haven't filled in your request. And essentially you will go onto Kaizen, you do a self-assessment, so you assess your own capabilities, and then you will put in a list of email addresses which the assessment will then be sent out to, and over time people will then fill in those responses, and once you have enough responses you can close the assessment. As I've mentioned before, there is an emphasis on having quality assessments rather than a large quantity of assessments, but it may not be clear what this means. What is a quality assessment? So a useful learning event will stretch the trainees. It will mean that you learn, and it's acting as a stimulus and a mechanism for reflection. It will help uncover gaps in your learning, so you may see a case and think, oh, I need to read about this. And it will also provide an opportunity for trainees to receive feedback from their colleagues. Trainees do not need to achieve a set number of Mini-CEX to CBD assessments or a set ratio between the two, and if you're a more junior trainee, it's expected that you might undertake more Mini-CEX assessments, whereas more senior trainees, because of the nature of their supervision and the complexity of their decision making, might do more CBDs. Finally, whilst this is not an assessment, there is also the development log section of the website. This is an area where you can make reflective entries. These are not assessments, but you can use this to link to curriculum objectives, and if you want to write things down and reflect upon something, you can do this in a way that it does not have to be countersigned by an assessor. There are multiple categories in the development log. The exact category doesn't really matter too much. Simply pick the one that matches most closely to the experience you wish to write about. So To get to the development log, again from your dashboard, you click on Timeline, click on Whole Timeline, click on Create New, and when you scroll down, you can see the development log. So you may use it to look at courses you have been on, or you may reflect upon clinical governance meetings, or if you have done presentations, research, or teaching. This is an appropriate environment to reflect upon how that has happened and link in those all-important curriculum domains. Now, it can seem overwhelming at first, especially as there are so many different options, but as long as you're meeting your curriculum domain requirements and you also generally meet the expectations that are set out in that table I showed at the beginning, which is available on the Royal College of Paediatrics website and the KSS website, and you're showing a good amount of learning and you're putting thought into your case-based discussions and mini-CEXs, then you should have no troubles with progressing.